Okay, good afternoon, everyone. I'm Lieutenant General Randy George, the Commanding General, 1st Corps and Joint Base Lewis McChord. I appreciate everybody joining us this afternoon. We try to do this at a time when we thought we could get max participation. Joining me today to my left is Colonel Aaron Steinpain. He's the commander of the 62nd Airlift Wing. To her left is Colonel Sky Duncan, the garrison commander for Joint Base Lewis McChord. And to my right is Colonel Tom Bunt, who is the commander of Madigan Army Medical Center. I will mention up front, we were going to have someone here and in the future, and we do plan on doing these again, to have somebody from Pierce County. We're in very close coordination with Pierce County, right across the street here as well, have a rep in the state EOC as we work through this. So we're very tightly linked with them. Okay, I want to just kind of say up front what we're trying to get out of today's session, and we'll obviously are looking forward to all the questions. 3 things that we would like you guys to take out of this. First is that we want you to know all the measures that we're taking right now to make sure that we keep our community safe. Second, we want to make sure that you guys know what steps you need to take for soldiers, airmen, civilians, and our family members to stay healthy. And then third is we want to make sure that you know where to find the most up-to-date information on what is happening right now with COVID and what's going on in our community. So I'd like everybody to write down, and we'll say this several times, home.army.mil/Lewis McChord. Okay, that is the Joint Base Lewis McChord website. On there, we have everything that we'll talk about today, to include frequently asked questions will be on there. We will continue to update these. Again, we're in close contact with Washington State health officials, Pierce County, CDC, as well as all the DoD assets that we have, and we will post that and continue to update that. And then we also have 2 24/7 hotlines that you will see on that website. You can access it at any time. Okay, I'm going to start off. I'm going to ask the first question, and we have a lot of experts here that are off to our left, a lot of medical experts. So I'm going to ask Dr. Paul Feistel to come up here and tell us, Doc, answer this: how can we best protect ourselves?
Sir, thanks for this question. And I think it's really important to take a few very basic steps that we all can take. So first off, more hand washing, right? And less face touching. So the average person touches their face about 10 times every hour. And so taking a moment to think about that. Especially important as well, stay home when you're sick. I think that's really important. Making sure that you just know ahead not to go to work when sick, and stay away from ill individuals as well. Lastly, sir, I think it's important to recognize that people with other medical conditions, those are the people that really need to be seen, and those are the people that we need to be careful of, and making sure they get this information out.
Thanks, Doc. I appreciate it. Okay. All right, we got a question here, and a good question. Is Madigan prepared for COVID-19, and do they have the test? Mackenzie, thanks for that question. Let me pass it over to Colonel Bunt.
Thank you, sir. Yes, to answer to your question is yes, Madigan is prepared for COVID-19. We do have tests available. Those tests primarily for service members, but also for beneficiaries. But the real issue with the test is whether or not the individual is exhibiting the actual symptoms that would be defined as COVID-19. And for that measure, it's really important to contact your provider and make sure you talk through those screening questions with them, and they can make sure you get where you need to go.
So, and the other thing that I'll highlight, Mackenzie, is that besides everything that we're doing at Madigan, and Colonel Bunt and his team are in contact with Washington State health officials, as well as everybody across DoD and the CDC. So whatever assets that we need here locally, we're tapping into all of those to take care of our soldiers, airmen, and our families. Okay. So we got another question here. Betty, thanks for the question. We are over 65. Should we stay away from public places? How about casinos? So I'm going to hand this over. Dr. Leonard, do you want to take this question?
So thank you, sir. At this point in Pierce County and Thurston County, there is no current guidelines for folks to stay away from large public spaces. In King County, there has been recommendations to do so. If you're concerned that you may be exposed, it is an ounce of caution is usually worth a pound of cure in this situation. But at this point, there's no base-wide recommendations for doing so.
Right, and the only caveat I would make, thank you, Dr. Leonard, the only caveat I'd make, he did mention the King County elements. The King County recommendations, as he stated, are a little different than Thurston or Pierce, and they recommend that if you're 60 or above and have other comorbidities that you stay away from crowded places at this time. Over.
So I guess, and I'm adding my own 2 cents in here, if you don't think you have to go to the casino, I would probably avoid it. Okay, so the next question here, and I'm going to pass this down to Colonel Duncan. Lisa, thank you for the question. Do parents need to plan on getting daycare services if schools are suspended?
Thank you, Lisa, for the question. Right now, we are in close communications with all of the surrounding school districts. We have 17 surrounding school districts that we send our students to throughout JBLM. We're in close communications with all of them, so we will ensure that we message out as soon as we know about any school closure. The CDCs, the Child Development Centers on base, are not necessarily linked to the schools. We will be in close communication with the schools, and if they determine they need to close a school, we will make a determination at that time also if we need to close the CDC, but they are not necessarily linked directly to each other. So will you need to find a babysitter if your school is closed? Yes, I would suggest you start looking at those options and start having some backup plans, just as in the case of any emergency preparedness. Preparing for this would align up with preparing for any sort of emergency or any sort of family difficulty. I would say that would be a prudent measure to take, yes.
Okay, thanks, Guy. Okay, our next question from Ashley is, how do we actually get a hold of a provider for advice? I'm going to turn that over to our Madigan commander.
Yes, sir, thank you. And thank you, Ashley, for the question. There are several different methods in order to get a hold of your provider to ask for advice. And the first one I would recommend is using the nurse advice line. It's posted on the website, it's posted on the JBLM website, and it's mentioned in the video that shows at our healthcare facility. I would recommend that as they follow the CDC guidelines, and then if they determine based on that you still require to speak to a provider, they do what's called a warm handoff, and they will contact that provider and link you in directly. The other method I would ask that you examine, if you're a beneficiary and you're enrolled to Madigan, you can use the patient portal. This is a perfect opportunity to use the portal. It's a great way to communicate with your provider, and they can communicate with you with PII and PHI type of information that otherwise you would not really want to relay on a telephone. Hopefully that's helpful to you.
Yeah, I just was, based on something that I've read, Tom, can you also comment on why you don't want to go, or you want to use some of these methods first over going to the emergency room?
Great question, sir. You don't want to present at emergency room if you have these symptoms, because you could potentially expose other folks in the unlikely event you actually have it. I would say that you want to use these methods as a way to prevent the spread of the infection, and they found that is very effective. And it also gives an opportunity to talk to you, because if you present in those environments and there are other illnesses out there that could help you avoid potentially contracting a basic flu or basic cold type conditions. So hopefully that's helpful to you.
And I wanted just to add one other comment on that again for all of this, and I should have mentioned it up front. If there's something out there, especially soldiers and airmen and their family members, the chain of command. If there's something you feel like you're not, you can't get an appointment, or something's not happening that you want to have happen, I want you to go to your chain of command and make sure that gets up. Our units have surgeons, doctors inside the units, and the chain of command can also help with that way. So we'll explore every avenue, and we ask that you do the same. Okay, our next question is from Allie. Allie, thank you. And the question is there a case of coronavirus at Madigan? I say no, but I'll pass it over as well to Colonel Blunt.
Yes, sir, that's the right answer. At this time, there is no case, presumptive positive or positive case of coronavirus on JBLM as well as Madigan.
Okay, next question from Ashley is, how will the coronavirus affect soldiers going overseas to affected areas, and does this put them and their dependents in danger? Okay, I'll take this one. Ashley, what we have already done, I've already restricted, so I'm the approval level for travel at this point in time, and the commander of the airlift wing is doing the same. For the airmen that approve any movement. We are not sending soldiers right now to any of the affected countries that are on there. So South Korea, Japan, Italy, China, I think Iran is on the list. We're not sending soldiers there anyway, but we're not sending any of our soldiers there. I've also directed that when any of the soldiers that would return from any of those locations, that we will have a 14-day quarantine that are coming back. And so we will work that, and right now it's in smaller numbers. I know we have some larger units that are deployed, and we'll be coming back, and you will need to stay up to date with your chain of command on exactly what that looks like. And how we'll go through that, but you will get the information, your soldier will get the information. And so with that quarantine and coming back, then they will be screened and making sure before they come back into our community that after that quarantine, that will keep our dependents and JBLM safe. So I don't know if you want to comment.
Yes, sir. So obviously we also have a responsibility as our air crew and airmen travel around the world to ensure that they stay safe and that we don't bring something back into our families and communities. And so we're definitely focused on ensuring we keep that risk as low as absolutely possible. If we do have to send a crew into one of those level 3 countries, we've made policies so that they don't remain overnight, so that we limit their time on the ground. And that when they come home, they know how to do self-assessments in order to ensure that either they don't contract something first, but secondly, if they are feeling ill, they know the exact steps to take to keep themselves and their families safe. So we're watching that very closely as we try to continue the mission while keeping the risk low.
Thank you, Aaron. Okay, next question is from Alondra, and the question is, are pregnant women at a higher risk? And I'm going to ask either Dr. Feistel or Dr. Leonard to come forward and answer that one.
Sir, I would say that this is very similar to the flu, so influenza, and I would say that pregnant women are certainly a risk factor for influenza and complications related to influenza. So I would do what you would do otherwise if you were pregnant. Stay away from others who are sick, wash your hands frequently, don't touch your face very frequently either, right? So the same recommendations are important. I think it's important as well to kind of a quick note about treatment here as well. And so there is no specific treatment for this condition at this time. There are some medications that are being looked at for potential treatment. So what would happen if you had a positive test versus you didn't have a positive test? Well, very much the same recommendations that I've said before. More hand washing, less face touching. And the treatment, of course, would be supportive care, more hydration, staying away from sick people. I said it once more, and then more hand washing. It's pretty uncommon to realize, but we don't really wash our hands very well. And it's about 20 seconds at a time to properly wash your hands. And so it's important to take your time with that and just to reteach you how to do that. So I would say, in summary, nothing specific other than being very careful if you're pregnant, similar to being flu season.
Thanks, Doc. Appreciate it. Okay, our next question is from Carmen. And the question is, I'm going to pass this down to Colonel Duncan, and I got some comments on it as well. Will JBLM start checking temperatures of soldiers and civilians coming through the gates?
So we are aware of some facilities around the globe that are screening people when they come on to base. We have that in what we call our health protection conditions level. We have a very clearly delineated structure of HPCon. That's the abbreviation we'll use, and you'll hear us say that. Health protection condition standards. Right now we are at HPCon Alpha. We were one of the first bases in the nation to go to that level, in the CONUS to go to that level, because of, we are surrounded by, we are near King County, and they sort of surround us on the north and the east. So out of a look at the caution, out of an abundance of caution, we decided to elevate to HPCon Alpha. That does not have any screening criteria at the gates. And what we will do is, as we go through, and if we see the need to elevate to Bravo or Charlie because of something going on base, or because of something going on off base but very close to us, Pierce County, maybe Thurston County, we're in communications with them, with their emergency operations centers, and the Madigan is in coordination with their health professionals. If we see that, we have a ladder that we will look through here, and we might institute screening at the gates in an elevated level of health prediction conditions. But again, right now there are no cases on JBLM or very close to us, so we are not screening at the gates at this time.
Okay, and Carmen, I want to be clear that we'll post this on the website. If we're going to change, anything's going to change that's out there that affects, we all know coming through the gate, and this obviously will affect travel times coming through the gate. So we'll be very clear about what we have to do when we have to institute it, and be very clear about what's happening. So we have talked about, we have a planning team that meets daily, all day, and has for about the last 2 weeks to kind of make sure that we're fully prepared for this and doing all the right things. The condition, things change, and that allows us to adapt to that. And when we feel the conditions change and warrant it, we'll be ready and prudent to take all the necessary cautions to do that. Okay, the next question is from TC. What is the plan if a case were to appear on JBLM? Okay, I'm gonna start. I think we all have a piece of that, and we'll start here with the medical first, as far as if we had a case.
Yes, sir. From TC, if we had a case, first line would be based on how that case presents itself. Let's say the case was presented by someone thinking they had the symptoms, and they contacted their healthcare provider through many of the mechanisms that we mentioned here already today. It was determined that they were exhibiting COVID-19 symptoms, but they were not severe enough to go to the facility, which 80% of the cases are. They would be advised to stay in their quarters, be quarantined. We will check on them twice a day, especially defining that as on post, assuming that would be the case in this particular one, and to monitor them in quarantine from the rest of their family members. At that point in time, we'll also advise the command here as well, who's going to make some of the other determinations as far as the base threshold goes with the HPCon levels, and I'll pass it on for those elements.
Okay, so the other related to this, and again, this is a good question, TC, a broad question. So it also would depend on whoever that was, as Colonel Bunt mentioned, is where they had been. So had they been to a location that was on this facility, and we have had a lot of discussions about then what we would do to make sure that we would make those facilities safe, and then be able to tell everybody else if something, let's say it was a post exchange or some other place on post. And so with that, I'm going to pass it down to Colonel Duncan.
So what we will do is, if we have a positive case, we will then go back immediately and do what we call the tracing. So we'll find out as much information we can from, of course, from the individual, and then through any other ways, any other people that that they've been in contact with, and we will advise those people if they might also want to self-quarantine. And so what we are advising is, if somebody has been exposed to somebody who is sick, so there's levels here of quarantine. If you've been around somebody who is sick but you're not sick yourself, it might go into isolation if you are sick, and we need to monitor you with medical care. This has different levels to it as well. So if it's a family member that's sick, we will ask you to quarantine at home, and we will come to your home if you're on base and to take care of you with medical professionals. If you're a soldier, we will also ask you to quarantine at home, but we might quarantine you in a barracks if needed. If it's a civilian, we will ask you to quarantine at home, and we will care for you in your home facility. Each person is a little bit different, but as one team, we will make sure that we communicate very clearly with you. If you want to self-quarantine because you've been around somebody who is sick, or if we think you need to self-quarantine, if we think you need to quarantine, then we will definitely be in communication with you. We have capabilities for these if need be.
Sir, if I may, I also just want to mention that this team up here has been lockstep with both the federal, state, and county governments and public health officials to make sure that we're not only following their guidance, but we also understand the responses that they have right now too. And so that's really important to make sure we have the right response at the right time.
Okay. This next question is from Cecilia, and it says, does Madigan have kits to test suspected cases? I'll turn it over to Colonel Bunt.
Yes, sir. Thank you. It would be the same kit, and that test would be administered based on the symptoms that are identified by the provider and shared between the two of you to determine whether or not that threshold has been met. That's a conversation between the provider and the actual patient. Is there anything else to add to that, Dr. Pastel? Is that pretty much straight? That's pretty much straight on. Still the case.
Okay, and again, I think what Aaron just mentioned is important too, that we have, we're working very closely and have been with Pierce County, King County, and we're sharing resources here. I think everybody saw the Vice President's visit here yesterday. So we have the ability to reach in to all those assets as well, and are sharing and being great teammates all around. Okay, next question is from Kelly. Is the base following any sanitizing procedures to avoid an outbreak in post in the more populated areas? So I will answer that yes, we have instituted that over the last week, and you'll see when you go to a lot of the public facilities, customer-facing facilities that we have put out. You'll see the flyers and the things that are posted, very similar to what's on the website. Hand sanitization, plussed all that up and continued. And again, if there's places out there that you think we need to focus on, then obviously we would appreciate your feedback. But we've had all of our medical professionals have been going around, preventive medicine, epidemiologists, our surgeons, everybody has been out, kind of looking to make sure that we're doing the right thing. I'm going to pass it down to Colonel Duncan.
Yes, sir. Yes, sir. This is a good time to also reinforce the cleaning supplies that we have throughout base. I'll just use gyms for an example. If you've visited our gyms, we already have paper towels and sanitizing solution that you spray on the paper towel, a disposable item that you wipe down the piece of equipment after you're finished. We will follow that same exact procedure, and in fact, that is a sanitization spray. When you're doing that, you're cleaning the piece of equipment for the next person. This is a good time to reinforce those same things that the good doctors have mentioned. If you're sick with any symptoms, whether it's a common cold or flu or something like this, again, self-quarantine. If you need to be in around public, that's when you would wear the mask. The person who is sick, use disposable tissues when you need to sneeze and cough. Stay 6 feet away from people. So there's a give and a take here. We would ask you if you are showing symptoms, please don't come to the facilities. But if it's a critical mission that you need to come to a facility for, like an ID card, you need an ID card in order to continue on with your daily life. Please communicate with us. We will do everything we can to support you at your home if you need to quarantine. Or if you believe you have symptoms that you need to stay away, we will work with you to bring the service to you if that is necessary.
Okay, next question is from Vanessa, and Vanessa asks, will service members returning from Pathways be held in quarantine? So again, I'll repeat. Right now, what we're talking about with quarantine, it's South Korea, Japan, anybody returning from Italy, China, and Iran. I'm not aware of anybody right now in the latter 2 countries. Might that change for Pathways? It might. So I don't know. But right now we're watching this on a daily basis. I think this gets to the earlier question of, hey, what are we doing to make sure that we keep our families safe back here? And that's exactly what we'll be looking at when they get back here. Is to make sure that if it's necessary, and again, we'll work with our medical professionals. CDC puts out a lot as far as where we're at with the different health threats in various countries, and then we'll be prepared to institute whatever measures we feel is prudent moving forward. Okay, next question is from Betty, and I'm an infantryman, so I'm not going to answer this question. How high of a temperature is a concern? So, Dr. Leonard or Dr. Feisel?
So thank you for the question. That's a very difficult question to answer because fevers tend to be very subjective. And at this point, we're using the term of a subjective fever, irrespective of the temperature, to be considered a fever. The most important thing to worry about, though, is if you actually need to seek medical care, that is, you have labored breathing or something that's very concerning that might require hospitalization. For the most part, though, however, we are still recommending that if you're ill with mild to moderate symptoms, that you continue to do all the things that we've been discussing. Self-home quarantine, staying away from folks, washing your hands well, just exactly the same way you would treat the flu.
Okay, thank you, Doc. All right, we got a next question here is from Barbara. Barbara says, my father is in the ICU in Chicago, and they have suggested that I stay home. So should I? And I assume that means should you stay home and not visit. So I'll pass it on to Colonel Blunt.
Right, and those are, honestly, those are facility by facility recommendations. And if a facility put out that recommendation, I would tend to heed that. If there's any particular reason or severe need to be present in there, that I would coordinate definitely with that facility ahead of time so the proper PPE could be obtained as part of that visit. Most of the time when they say that, though, is because they have active cases, and the ICU is where we would isolate those particular cases. Dr. Feisel, would you add anything to that particular piece?
I think it's very accurate, sir. Sort of getting your correct location, making sure there's airborne isolation and precautions are taking place. And so the staff at Madigan are working very hard in making sure that we prepare and we prepare ourselves, making sure that we stay safe. We know that coronaviruses in general can be a problem in healthcare workers. And so ensure that we as Madigan employees are staying safe so that we can continue to take care of the patients that come into our front door.
Okay, the nenext question is from Brooke. And Brooke asks, are the same policies in effect at the National Training Center in Yakima? So I'll answer this. I'm going to look around. I might throw out a lifeline for this one, but as far as Yakima here and everything that falls under the First Corps and JBLM purview, they will fall under the exact same rules. And whatever we put out from here. So that will be the same. National Training Center, again, I think that and if you do have specific questions on there, we can definitely link you to them, but I don't think, I expect that there's going to be Army-wide policy put out, the same as what we have already put out as far as travel to and from South Korea, Japan, China, Italy, Iran, those same countries, because of the coronavirus cases. I think that the NTC will follow that. What they're specifically doing as far as travel, what we're doing, I'm not as familiar with, but we can certainly, if you have a concern, I would actually get with your chain of command and then let us know, and we could definitely follow up with you on more details on that one. Okay, this is a question from Jessica. I'm going to pass it off to Colonel Bunt. The question is, has the visitation policy changed at Madigan due to COVID-19? What about labor and delivery?
Thank you, Jessica. Great question. Glad you asked, especially when we have so many mothers out there. I would say at this time, the visitation policy has not changed. But along those same lines, it's a very fluid situation. So I would ask that you keep an eye on the website. You call ahead with the staff just to validate and verify prior to any kind of visitation to make sure it's still all right. But right now, the visitation policy has not changed.
Okay, thanks, Tom. Okay, the next question is from Virens. It says, is there a team that can bring test kits off base? I know we can throw this around a little bit, but I know you can start this. Go ahead.
Try to help my team out here. Is the whether or not if you're off post and it is a symptomology that's gone over the provider and it's determined that your case is one that would be subjected to a kit examination, that coordination will take place with the public health department for that particular county, each one having their different establishments, and we'll coordinate to make sure that that is provided. At this time, that is what they've asked us to do. Yeah, and there's no further follow-up from Dr. Feistel, so that's still accurate.
Okay, thanks, Tom. Okay, the next question is there a travel restriction for PCS, TDY, or deployments? Will soldiers coming home be rerouted through unaffected countries? Okay, good question. So yes, right now we're expecting that there will be a 30-day change right now for permanent change of station to the countries that I mentioned earlier. So specifically, probably for us, Korea, South Korea, Japan, or Italy. Right now, PCS, just like we've had TDYs right now, got word down from headquarters, DA, and FORSCOM that there will not be any PCSs to those locations, that there will be a 30-day or basically a reevaluation of that. Is that right, Butch? And 30 days. So, and then will soldiers coming home be rerouted through unaffected countries? Obviously, when our soldiers are coming home, they will, as what I mentioned earlier, as far as the quarantine, and yes, they will be rerouted through unaffected countries. I think they've done this at Fort Hood as far as bringing soldiers home and what they're screening and the quarantining, and we'll definitely go through those processes. Yeah, go ahead.
This is a good chance to amplify. If you are one of those people that might be under orders, and this is new information that we're clarifying right now as to this 30-day moratorium on PCSs. If you're one of those people, please communicate closely with your chain of command. And we have the Military Personnel Directorate that does all the orders and works with Human Resources Command for soldiers. And if you're an Air Force airman, we have the folks in Building 100 that are very closely tying in with Air Force Personnel Command to make sure this is that we get you the very latest information. So work with your chain of command, please, and call either one of those offices, and we will ensure you get the latest information.
Okay, question from Young, and the question is it possible to have a health screening for everyone that's entering the schools and CDC? So I don't know if it's possible. Again, I'm just going to reiterate, and I'll turn it over to Colonel Duncan. We do have measures that we are working through and considering based on recommendations from our health professionals. We'll be very prudent about these and a caution for our soldiers, airmen, and family members about implementing them. So we will increase measures, and some of the measures that we increase will cause a little bit more delays and problems in these. But up to the specific health screening, is it possible? I'll first go to Colonel Bunt, and then we'll go to Colonel Duncan.
Well, it's almost like a two-part question, Ms. Young, is yes, it is possible. However, this time it's not recommended. And then the other part of this that needs to be a consideration for this is every time we do kind of these changes of requirement, that adds the potential of gatherings of people and choke points and things like that. So we kind of dissuade that. And in the fact that we're not in an area that is in what they would consider more of an active AOR, more like Seattle is and a couple other locations, that's currently not the recommendation, but that could very well change in the future depending. Please keep an eye on the website, and I'll hand it down to Colonel Duncan if he's got anything else to add.
Thank you. So what I'll say is if it's somebody we talk about health screening for entering schools and CDCs, both of these capabilities, both of these entities or child development centers in our schools have nurses on, either on the facility or easily on call. So they will make the call if a child is showing symptoms, please go see that healthcare provider as soon as you can. And again, we would ask that the parent not bring the child if they're showing symptoms, that they call their healthcare provider and go through the healthcare process before getting there. But if a child is showing symptoms there, we will immediately call the nurses, again, either on site or bring one in to evaluate that child. As of right now, for a health screening to get into the CDC, no. We are not doing any of that. We're not doing any screenings to get into the schools because, again, there are no cases right now in the area close to us, and certainly none on JBLM. So we do not see that as a necessary precaution right now.
Okay, Angie's asked a question here that kind of relates to what we were just talking about. How will we be informed if a case tests positive on JBLM? So. Yes, we will make sure, and I think we've mentioned up front, we'll be transparent. We will tell you what we know. There'll be certain things that we obviously won't share with you to protect certain individuals, HIPAA and those pieces, but we will tell you. It also gets back to what Colonel Duncan was mentioned earlier. Anybody who might have come in contact and done the retracing, that will happen as well. Anything anybody wants to add to that? Okay, this next question's from Nikki. Could people be walking around thinking they have a cold/flu and actually have the coronavirus?
Sir, I'd say there's always that potential. It depends on whether they've had contact with an individual who has active case, and they would be the first ones, obviously, to know that in most cases. However, the symptomology for the flu is very similar to that of COVID-19. And I think the important thing to do in those cases is the actions are still the same. They're still to self-quarantine. They're still to kind of isolate yourself, to be cognizant of your public responsibility in that respect. And then if it gets more severe, who to contact and when to contact. That's probably the best advice I can give you. That's pretty much it on our end, sir.
Okay, the next question is from Sylvia. And Sylvia asked, is there any concern for a food or a water shortage at the commissary? So I've not heard any of this, but I'll pass it down to...
We are definitely aware of the surrounding community having shortages on things like toilet paper, paper towels, water, bottled water. Right now, the commissary has good stockages. Commissary specifically has good stockages of those water antibacterial wipes. In fact, they just put a couple pallets of antibacterial wipes right out in front where people can get to them easily. Right now they have good stockages, and they are definitely doing all they can with their suppliers to ensure that those stockages remain. So we have a great partnership with both all the APHIS facilities on base and all the DECA, the commissaries on base, and they are already putting in requisitions to bring in more of those highly needed supplies as they categorize those.
Okay, next question is from Gracie, and the question is, can family and friends still visit here at JBLM? The answer right now is yes. Can we travel within the United States? The answer to that is yes.
Yes, sir. There are certain there are often certain travel restrictions that'll come up, and the CDC will work with the different locations of whether those are in existence or not. But as of right now, we don't have any restrictions that I'm aware of.
Yeah, no travel restrictions in the United States. I'm sure the airline industry would absolutely be interested in you still traveling if you'd like to. And a little known fact is that the air inside of aircraft is actually constantly recirculated, and it is actually a pretty good environment for those to travel in. So we hope that while we take the coronavirus seriously, and there is a risk, the risk is still low, and you'll go on with your daily life right now.
Thanks, Erin. Okay, next question is from Erica, and definitely to our health professionals here. From Erica, the question is, what are your recommendations for those with pre-existing health conditions?
Thank you, Erica, for the question. I would say in that respect is to heed the same methodology for those just basic protective measures, but also try to stay away from crowded areas and areas where there could be potential for transmission. Make sure you're washing your hands very regularly and that you're following all those precautions that have been talked about in extensive detail by Dr. Festel and team, and I think that's probably the best recommendation. And if you do not have to go to a particular area, I would probably try to avoid that at this time.
And again, if they need any specific questions, they can go to our hotline. We have a couple of them, and I know definitely get on the Madigan, from there, the Madigan Army Medical Center website, and get specific advice, and oftentimes that's what's required for each individual. Okay, so the next question is, what happens if the base gets shut down? Can you get on or off?
So we are consistently monitoring the priorities of ensuring we protect our force, ensuring we protect our families, our civilians, our contractors on base, and meanwhile, equally as important, making sure we maintain mission readiness. So if for some reason we had to go to that extreme level, I would suggest that would be quite an extreme level if we had to lock down the base or close the gates. That means that this is progressing to a pretty high level, which if we go to that level, it means it is to protect the mission, protect our ability to still deploy forces, and to protect the people on the base. Again, the civilians, the soldiers, the airmen, the contractors that work and live on base. We will that would be a large. That would be a large piece of information that we would heavily communicate through all available channels. We would communicate that through our community partners, through our county, state, of course through federal government agencies. So that is something I would suggest if we got to that level, we will work through to it gradually as we again progress through that ladder of health protection condition levels. If we got to that point, it would be weeks down the road because things progressed slowly. And this is a very fluid thing that we're all adjusting to as it comes. But we will ensure that we communicate closely with you. And this is a good time to mention. Please continue to go to the websites to pull information from places like home.army.mil/Lewis McChord, from the CDC, from the Madigan website, from the Wing website. and also to sign up for Alert. That is the DoD capability to push information to you. How to sign up for Alert, that is also on the webpage. I would just suggest that's the one way we can push emergency information to you. And always free to sign up. We recommend everybody signs up for it at any time, but if you're concerned about getting information in this particular case, a great opportunity to sign up for it now.
Okay, Colonel Duncan, I'm going to come right back down to you. Question from Carmen. Are the gyms on base doing anything to prevent the spread of the virus? I know you kind of mentioned this briefly, but if you can hit that again.
Yes, sir. We are absolutely. So again, those disposable wipes that we have, disposable paper towels. You pull a roll or two off, and you spray onto it with the antiseptic spray. You spray onto the paper towel. You wipe down the piece of equipment, and then you throw the paper towel away. That does multiple things. It, of course, it puts it onto a disposable item that you can throw away. So in case that disposable item picks anything up, it cleans the piece of equipment so that we leave it clean for the person that comes after us. And it spreads any disease, any flu symptoms, any flu-type disease, including COVID. And then also we are distributing throughout the gym facilities just the antiseptics, pumps, anything that is alcohol, sort of 60% and above, 60 to 80% alcohol content, it can kill this. And so we are distributing those as well as an additional measure. But please continue to use the paper towels and the antiseptic sprays that we have distributed through the gym facilities. That's a good question. Thank you.
Okay, question from Chastity. The question is, if someone is confirmed having the virus, when are they considered no longer a threat to spread it to others? And can you get it more than once? So 2 questions in there. When are they considered no longer a threat to spread it to others? And can you get it more than once? And I'll hand it over to our hospital commander. Thank you, sir, and thank you, Chastity, for the question. That's based on the timeline as the illness would run its due course, and as right now it stands at 14 days is the running of the course. However, that could be a little bit longer, a little bit shorter, depending on the type of indicators that you have from the illness and your discussions with your provider. Whether or not you can get it more than once, that part I do not know. Remember, this is a novel coronavirus, so we know very little about it, and it's been only in existence actually for a few months, for that matter, that we're aware of. So there's not a whole lot of information on that at this time, but there are certain elements, like any illnesses, where antibodies build up and add as an immune protection system for that. But I will let Dr. Fastel kind of comment on that further, being he is my professional.
Thanks for that question. So I think it's a very, very appropriate question. So these types of respiratory conditions spread by people who have fever and people who are coughing. And so we feel, and I very much agree with Colonel Bunton, who just mentioned, is there's very much that we have yet to learn about this novel condition. And so we do know, however, a lot about the flu. And so those individuals who are fevering, those individuals who are coughing, those are the folks who spread conditions. And so likewise, once those conditions go away, those people are thought to be less infectious. So I think a quick a moment for a point of discussion. So there's a lot about what we don't know. We don't have a vaccine. We don't have medication to properly treat this yet. What do we have, right? What do we have to fight this? We have this kind of an event, I think, in my mind. Knowledge. Once we gain this kind of knowledge, we ourselves are the best antiviral issue that we can work on together as a team, as a community of JBLM, right? Working on this condition. It's going to take all of us. It's going to take all of us being responsible and washing our hands, doing things properly, to, like we've been kind of already mentioning, that we ourselves, through knowing what our enemy is, I think is the best way forward. We're mission focused here, right, on JBLM, and this is our mission right now. Our mission is to succeed against this virus, and we're gonna do just fine doing that. It's gonna take some time. It's gonna take a team of individuals that we have here today, and we're gonna do just fine as long as we continue to follow these recommendations.
Okay, doctor, don't go anywhere. Got a question from Cassandra, and said, if there is a breakout on base, so some breakout of the coronavirus on base, what happens to soldiers with children under
5. So I imagine no different, but maybe there is.
Right. Great question. And so for some reason, kind of keep on going back to the novel coronavirus that we're facing. And so for some reason, children are less affected at this point. So from our experience from overseas, what we know since December 31st is that for some reason, younger individuals are considered really less of a problem. So most of the individuals, the outbreak that King County is currently facing is individuals who are older. So even though your question is very appropriate, we would very much be full, all hands on deck in that kind of scenario. Thankfully, at this time, it's thought to be less of a problem in younger individuals. So we'll keep an eye on that. My department works very closely with the for the child care centers and the public health nurses. And so I think we're just going to keep a close eye on that and monitor.
Okay, don't go anywhere, doctor. I got another question from Patricia. How long can the virus live on surfaces?
Once again, great question. And so coronavirus in general, our thought there is some persistence in the environment called the fomites, I guess. And so there is not a lot of data in regards to this 2019 novel coronavirus in terms of how long it lives on surfaces. However, I think it's important to kind of recognize how would you get infected if that were to happen. So let's say you're walking through a commissary or a place that someone is coughing. So that person then coughs onto a cereal box, we'll just choose, and then you would pick that cereal box up, and then to be infected, what we think, you would then touch your face, you would touch your nose, you would touch your eyes. That, as we already talked about, is not a good idea in today's day, right? So that's kind of the more important question I'd like to focus on is there is some persistence of this virus in the environment. However, it's thought to be less problematic. Certainly, if it's a drier environment, that's a big, it's a kind of a protective factor, the more dry in a cereal box example. But certainly, you're more at risk if you go out and you touch your face after you've just touched something that someone else just coughed on.
Okay, thanks, Doc. You can now take your seat. Okay, the next question is from Hero, and Hero asks, can guards at the gates check our IDs without touching them? So I'm going to turn it over to Colonel Duncan, but this is something that we do have the ability, and this is one of the measures that he was talking about before that we can definitely move towards.
That's a good question. And really quick before I answer that one, I'd like to amplify a little bit of what Doctor said. We are also expanding the cleaning of the kind of the main public areas. So to sort of amplify on what he was talking about, make sure you don't touch your face and your eyes after touching surfaces. We are cleaning. We are doing extra cleanings right now of common areas to ensure that we can keep this tamped down as much as possible. As far as screening without touching the ID card at the gate, that is something we might progress to again. I'll refer back to that health protection condition standard. The gates is a key part of that. So I'm glad this question has come up a couple times because it is a key part. We have 55,000 vehicles on and off base every day. It's close to 75,000 people. So we have to make sure that we can allow those people to come on to enable the mission to continue, but we also have to ensure that we're protecting the people that are on base. So if somebody is coming on sick, we might institute a screening criteria. And one of those steps might be that we scan the ID card while the person that owns the ID card still holds it. So what we'll do first, as a first measure, we'll probably just issue gloves, neoprene gloves out to all of the people at the gates so they can still grab the ID card and help to scan that quickly because we have to get vehicles through quickly. That's the other piece of this. If we have to go to, we elevate it one more level, then we will probably go to something where we screen it from while the person still holds the ID card and or the person uses the kiosks, which are at most of the gates.
Okay, thanks, Guy. Next question is from Kayla. And it says, and her question is, if I'm quarantined, how long do I have to be under observation? And I'll turn that over to our hospital commander.
Yes, sir. Thank you, Kayla, for the question. That goes back to a very similar previous question on the quarantine. You're still under observation for 14 days. That could change based on discussions, and obviously if you do not remain asymptomatic. that would change that. But right now it's at 14 days, asymptomatic cases, and then that discussion with your provider before the quarantine closes. Thanks, Tom. Okay, next question is from Karen. If a family member gets the virus, are there special precautions I should take in caring for them? Good question. Doctor, come on back up. You had a chance to drink some water.
So once again, very good question. And really the recommendation at this point is that to really separate within the house. So the house is really felt to be the best location for that period of time. And so if there's a separate room, usually a separate bathroom, and having a life support plan basically to make sure the food is properly served at a separate location as well. We know that coronaviruses, it can spread during the process of eating. So really just separation during that period of time.
Okay, hang on to the mic, Doctor. I'm confident this one's coming to you. This question's from Crystal. It says, what is the difference between the flu and coronavirus if they present with similar symptoms?
So there's been a lot of discussion about the flu versus coronavirus, and I think it's important to recognize that influenza, I think, a couple things. So once again, very appropriate question. So just last week we had about 40 cases of influenza at Madigan. So flu is alive and well. Doesn't want to say goodbye to us this year, quite just yet. A bad flu year is a significant issue every year in the U.S., right? So even here locally within Pierce County, we've had deaths related to influenza and about 50 deaths in the state of Washington, as far as I'm aware, this year to influenza. So a serious issue that, of course, we have a vaccination for. So one of the first things is really to kind of make sure you get vaccinated. But I think if I could answer this question real quickly, so for regards to influenza, so a bad flu year, about 0.1% mortality. What does that translate? There's a lot of deaths in the United States every year, even though it's 0.1% mortality. This condition for coronavirus, for the novel coronavirus 2019, the mortality experience that they've had in China specifically is right around 2%. So quite a bit higher, but that being said, it's important to recognize as a whole it's 2%. In certain subgroups, it's much, much higher, around 14% in certain very sick subgroups and individuals who are a lot older. So in general, it's a lot more problematic, but it's still important to recognize flu is still here and very much a major contributor to why people are here presenting with fever and cough still.
Okay, we just got a couple minutes here left. Time for more questions. We'll take two, so we'll get another one. And the question from Deborah is, are the pools safe to swim in? I'm getting a big head nod. Yes, come on up there, Dr. Faisal.
So we've just got some information from Washington State Health Department, echoing everybody's sentiment here. These are some experts in the local county and Washington State Department of Health, and leading the way in the nation, in my opinion, for Department of Health. And so the answer is that as far as we know, water is not felt to be a main contributor for the coronavirus. That's a question that was asked, and they've already answered it for me.
Okay, thank you. Okay, last question here is from Rachel, and the question is, do the schools have the necessary support with supplies like hand sanitizers and wipes, and would it be productive for the community to bring donations? Good question, Rachel.
I really love the second part of that question. We hadn't thought about that yet. We need to look at maybe soliciting if people have extra supplies. If it gets to the point where we need to distribute that out, that's a great point. Thank you for bringing that up. But to answer the first part of the question, yes, the schools just like JBLM Broad have the supplies. We have either the cleaner that does it as a contract, they have the antiseptic supplies and the cleaning supplies to do regular cleaning, and they are doing deep cleanings. We've been in contact with many of the school districts. They're doing deep cleanings in between large gatherings, even though, again, no cases reported. They're just as a precaution, they are deep cleaning in between large gatherings, and they are definitely thoroughly cleaning classrooms. And they have the capability to do that with their current cleaning contracts, just like we do here on JBLM. And our cleaning contractor is gathering up the necessary supplies to be able to continue that for a long time, regular cleaning and deep cleaning.
Okay, thanks, Guy. All right, we're going to take one more question, because this is a really good one. Hasn't been asked yet. From Nancy, what does the test for coronavirus entail, and do I need to give blood? Turn this over here to...
So thank you, Nancy. And it does not require a blood donation for the test. It is a nasal swab test. But on that same guidelines, I'm going to do a shameless plug for, yes, you can still also donate blood, as it is not transmissible, right? And they do the regular, just as if you were sick and you wanted to donate blood. They do a screening questionnaire for you and run you through it, and you're healthy. You can go ahead and donate blood. If you become ill or think you're going to be ill, or you think you are ill at a later date, you contact the blood folks. They can pull that particular sample. But right now they're telling me they can still take blood donations.
Okay, we're going to close it up. I'm going to pass it over to our Airlift Wing Commander first for a couple comments.
Sir, first of all, thanks for your leadership on this topic and for hosting this event. I think it's really important that we ensure that our airmen, soldiers, family members, dependents, and contractors, that you know how seriously we're taking this issue, that our goal here is transparency to make sure that you can make educated decisions for you and your family, and that you know that we're taking very measured steps, that we're lockstep with the public health officials in the county and the state, and that we'll continue to watch this very closely and take prudent and measured actions. And so, again, we want you and your families to be safe. That's our number one priority here, and yet we still have a mission to get done, and we'll continue to do that also. Thank you again, sir.
Okay, very well stated, Aaron. Thanks. Tom, you got a couple of things you wanted to...
Yes, sir. I just want to, as a couple last parts, thank you. This has been a great opportunity for us to be able to share with the community, just another form of communicating, but also a great thanks for all the questions that came in. Those questions were fantastic, spot on. This is exactly what we want, and keep those coming, right? I also want to give a big thanks for the team here that supported all these activities today, and they've been working hard, many of them 24/7, and so with that, I think we owe them a great deal of our thanks, and they do it for you. Please keep an eye on the website for any changes or updates to information. It's a very fluid situation, and what could be happening one day could change very well the next, so please be vigilant about that. I know our teams are being very vigilant of updating those sites, so please take advantage of it. Please heed the recommendations and discussions for protection measures. Those are very important. The more we're in compliance with those, the less likely the spread of this particular illness. The hotline's available for you out there, as well as the CG had mentioned, for any vulnerabilities you might see in terms of missing a sanitizer station or something's run out or what have you. And so we need a real community force effort in order to get after this, as Colonel Stainpine mentioned. Please do not present at the emergency room if you believe you have that particular illness, because you could jeopardize others' current medical conditions. So I just ask that please, again, you follow the protocols and safeguard the community. Household cleaners are very important, and nearly all of them are effective. You can just read the label. There's 60 to 65% alcohol contained, and many of them will actually mention on there effective against coronavirus, because it's a very common virus family. And if you're sick, please stay home. We're honored to serve you, our community, our family. Thank you.
Okay, I'm gonna close out where we started. There's three things we wanted to get at today, and the first was make sure you know what steps we're taking to ensure everyone's safety. Again, it's been mentioned. It's going to be on the website. We will communicate. Be very transparent about what we're doing. I think we've communicated the steps and procedures that we recommend you take to keep your soldier, airman, family members safe. If you have any questions, though, again, hit the hotlines, go on the website. We have a lot of resources that are available to you. And last was, where do you find that most up-to-date information? And we're continuing to hit that. We want to make sure that all the information as we get it is available to all of you and at your fingertips. If you have specific questions, I think you've seen that we've had a team that's been responsive on our social media sites, answering questions for you. I would encourage you, if there's somebody else, if you thought this was helpful over the last hour plus, that it'll be on the site. So they can go back, and if you joined us late, they can go back and watch this video from start to finish, and you'll get a lot of the questions, some really great questions today answered. So again, we are honored to serve with you and serve all of you. Have a great weekend. Thank you.